Hey everyone, and welcome to HerHealth Matters, the podcast where we dive deep into the health issues that impact women the most, across all stages of life. I'm Alex.
And I'm Bri. Today's episode is all about the top 5 health disorders affecting women globally, and why they are more than just personal problems, they are public health priorities.
Exactly. We're talking about heart disease, breast cancer, depression, and anxiety, common gynecological issues like endometriosis and polycystic ovarian syndrome, and autoimmune diseases. These aren't just statistics, they are shaping women's lives, silently and sometimes invisibly.
Let's start with cardiovascular disease. Globally, it's the leading cause of death among women, accounting for over 8.5 million female deaths annually. That's about 35% of all female deaths worldwide.
And yet, heart disease is still seen as a man's disease in many parts of the world. In places like South Asia and Sub-Saharan Africa, women face additional barriers, like late diagnosis, lack of access to care, and cultural stigma.
Plus, research shows that women in low- and middle-income countries are more likely to die from heart conditions than those in high-income countries, even when the symptoms are the same.
Let's talk about breast cancer, the most commonly diagnosed cancer worldwide, not just in women. In 2020 alone, there were 2.3 million new cases globally, according to the World Health Organization.
And over 685,000 women died that year from breast cancer. But here's the thing, survival rates vary dramatically. In high-income countries, early detection and treatment mean survival rates above 80%. In lower-income nations, survival drops below 40%.
Lack of mammography, limited access to treatments like radiation or chemotherapy, and even basic awareness are big obstacles in many regions.
Exactly. There's a huge need for international investment in women's cancer screening programs, especially in rural and underserved areas.
Mental health is a silent crisis for women globally. According to the Global Burden of Disease study, depression is the leading cause of disease burden for women aged 15 to 49.
And globally, women are about 1.5 to 2 times more likely to suffer from anxiety and depression compared to men. But access to mental health care is incredibly uneven.
In some parts of the world, there may be only one psychiatrist per 500,000 people. In others, mental health is still seen as taboo, especially for women, who might be discouraged from speaking up.
Add in the mental toll of poverty, conflict, displacement, and gender-based violence, and it's easy to see why this is a global issue, not just a personal one.
And polycystic ovary syndrome, PCOS, affects around 8 to 13% of women of reproductive age globally, but in many regions, women go undiagnosed for years.
Gynecological conditions are some of the most underreported and undertreated health issues globally. Let's take endometriosis, for example, affecting an estimated 190 million women worldwide.
In many low-income countries, lack of access to pap smears and HPV vaccines means cervical cancer is still one of the leading causes of cancer death among women.
Let's not forget gynecological cancers. In 2022, over 1.4 million new cases of cervical, ovarian, and uterine cancer were reported globally, leading to about 680,000 deaths.
Autoimmune diseases, like lupus, rheumatoid arthritis, and multiple sclerosis, affect around 5 to 8% of the global population, and nearly 80% of those diagnosed are women.
This is a space where prevention could save millions of lives, but only if awareness and access improve.
Lupus, for instance, is 2 to 3 times more common in women of African, Asian, and Latin American descent, yet most clinical trials still don't reflect that diversity.
Yet in many countries, autoimmune conditions are poorly understood, underdiagnosed, and often misattributed to stress or emotional problems, especially in women.
And these conditions don't exist in isolation. Mental health affects heart health. Polycystic ovarian syndrome increases diabetes risk. Cancer treatments impact fertility. It's all connected.
We need global efforts to fund inclusive research, provide better diagnostic tools, and recognize how these conditions affect women differently around the world.
So whether you're listening from New York or Nairobi, Sydney or Sao Paulo, your health matters. And the world needs to care more.
The common thread here. Gender bias in healthcare systems is a global issue. From underfunded research to cultural stigma and economic barriers, women everywhere face hurdles in getting proper care.
We'll look at what's driving the numbers globally, talk to experts, share real stories, and explore the newest research and treatments shaping the future of care for women everywhere.
Exactly. A lifespan-based, integrated approach is essential, one that doesn't just focus on reproductive years, but on a woman's entire health journey. Today was just the beginning. So if something resonated with you today, be sure to subscribe, share this episode, and join us next time.
Thanks for joining us on HerHealth Matters. Until next time, stay informed, stay healthy, and keep raising your voice.